हॅलो गाईज, नर्स पॅराडाईज या माझ्या यूट्यूब चॅनलवर तुमचं स्वागत आहे. मी आहे तमन्ना आणि आज आपण बघूया नर्सिंग क्वेश्चन्स अँड आन्सर्स 2025 पार्ट 7. 10 क्वेश्चनची सिरीज असणार आहे फॉर ऑल कॉम्पिटिटिव्ह नर्सिंग एक्झाम्स. लास्ट पार्टमध्ये मी तुम्हाला क्वेश्चन दिलेला, त्याचा आन्सर मी तुम्हाला या पार्टमध्ये सांगणार आहे. चला बघूया तो काय क्वेश्चन होता. एक्स्ट्राव्हेसेशन रेफर टू, आणि तुमचे ऑप्शन होते. ऑप्शन ए लिकेज ऑफ फ्लूइड इनटू द टिश्यूज, ऑप्शन बी वेनस कंजेशन, ऑप्शन सी इन्फ्लामेशन ऑफ द वेनस सिस्टम, and ऑप्शन डी लंग इन्फेक्शन. And your right answer is option A. Today's our first question is, where is the antecubital fossa located? And your options are: option A depression in the bend of the knee, option B a depression in the scalp, option C a depression in the bend of the elbow, and option D none of the above. And your right answer is option C. Your next question is, the tip position of a PICC is usually confirmed by. And your options are: option A palpation of the lung, option B auscultation of the lung, option C CT scan, and option D X-ray. And your right answer is option D. Your question number 3, crystalloid refer to, and your options are: option A solution that can diffuse through a semi-permeable membrane, option B a solution that cannot diffuse through a semi-permeable membrane, and option C another word for water, and option D normal saline. And your right answer is option A. Your next question is question number 4. Midway through a blood transfusion, a patient complains of severe back pain. What should the nurse do? And your options are: option A reassure the patient, option B stop the transfusion and take vital signs, inform the nurse in charge, and option C speed up the transfusion, and option D administer analgesia. And your right answer is option B. Our next question is question number 5. An immunological reaction is also known as. And your options are: option A anaphylaxis, option B shock, option C acute hemolytic reaction, and option D hypovolemia. And your right answer is option C. Your next question is, an autologous blood transfusion refers to. And your options are: option A blood that has been screened, option B blood that is taken from the patient for their own transfusion, option C blood that is taken from the patient's blood relative, option D blood that is donated through the blood transfusion service. And our right answer is option B. Your next question is question number 7. What baseline observation does the nurse need to undertake prior to a blood transfusion? And your options are: option A BMI, temperature and blood pressure, option B pulse, BMI and blood pressure, option C blood pressure, and option D blood pressure, temperature, pulse and respiratory rate, depth and rhythm. And your right answer is option D. Your next question is question number 8. What does the term oliguria means? And your options are: option A reduce urinary output, option B increase urinary output, option C no urinary output, and option D infected urine. Right answer is option A. The next question is, assessment of the patient's nutritional need should take into account. And your options are: option A age, ethnicity, weight and social status, option B age, ethnicity, weight, religion and social status, option C physiological need, religion, cultural and age related need, requirement and request, option D age, height and weight. Right answer is option C. The next question is, biometrical impedance refer to. And your options are: option A malnutrition, option B another term for BMI, option C an electrical measurement of total body water compared to the body fat, option D the amount of electrical activity in a muscle. And your right answer is option number C. Your next question is, body mass index means. And your options are: option A is a measure of body fat based on height and weight, option B is no longer used to assess fat based on height and weight, option C can be only be applied to men, option D can be applied to women? And right answer is option A. The next question is anthropometric measurement includes, and your options are option A neck to head circumference, mid upper circumference and skin fold thickness, and option B mid upper high circumference and skin fold thickness, and option C waist circumference, mid upper arm circumference and skin fold thickness, and option D hip to waist ratio, mid upper arm circumference and skin fold thickness. Right answer is option D. Your next question is pain is assessed by, and your options are option A listening to the heart rate when the patient is at rest, option B the use of observation, questioning and assessment tools, option C a calculation of the heart rate multiplied by the respiratory rate, option D measuring the amount of glucose in the urine. याचा आन्सर तुम्ही मला कमेंटमध्ये सांगायचा आहे. नेक्स्ट पार्टमध्ये याचा आन्सर मी तुम्हाला सांगणार आहे. सो लाईक शेअर अँड कमेंट सबस्क्राईब माय चॅनल. थँक्यू.